Really excited to be here the second day of HIMSS. Hope you guys had a good first day here in Las Vegas. Seal Shield is here celebrating our 20th anniversary and our 19th year at HIMSS. HIMSS, the IT show, but we're here because of the critical relationship between IT, information technology, and IP, infection prevention. Seal Shield, all of our products straddle that line between IT and IP, solving IT problems while providing solutions and best practices that support IP initiatives. And we're very excited to have our Puerto Rico representation here today. Wow, Puerto Rico in the house. How about that? You guys are popular. Fantastic. Well, we're really excited today to talk to a couple of our special guests. First, we have Eliezer Melendez. And give it up for Eliezer. Eliezer, you guys obviously know him, but he's the Vice President of Business Development at Trinexus and one of the owners and founders of Group Trinexus, a diversified technology organization established in 2003. With 30 plus years of experience in the IT and technical industry, 10 years of experience working with government, and 10 years in Oracle. They had a good announcement yesterday. Eliezer has built a career centered on strategic growth, enterprise technology implementation, and regional industry leadership across Puerto Rico, Caribbean, and Latin America. Welcome, Eliezer. Thank you for being here.
Thanks for having me.
And joining Eliezer is Francisco Caceres, Paco. All right, yeah, oh wow, a popular guy, okay. Francisco is the Chief Information Officer at Dorado Health, where he has served since 2012 with more than 28 years of experience in information system and telecommunications, including 12 plus years dedicated specifically to HealthIT. Francisco successfully leads enterprise technology strategy, service delivery, infrastructure modernization, and digital transformation initiatives. Welcome, Eliezer and Paco. Appreciate you guys being here today. So obviously we're at an IT show and you're representing Puerto Rico. Tell us what makes Puerto Rico healthcare landscape different than the domestic US based healthcare.
Yes, that Puerto Rico is unique based that we have every kind of healthcare around. So we got hospitals, we got health plans, we got Medicare, Medicaid. So landscape is, and we need to comply with CMS and Joint Commission. So we are a very an island, and it's a small island, but we got everything around our healthcare industry that we are.
And the weather's better. Right?
And the weather better,
right?
beaches and golf.
Okay, yeah. Resort healthcare.
We have to play by the same rules as here, CMS, EPA, FDA, but we receive much lower funding. That's the difference. It's a little bit challenging for us to acquire new technology because we don't have that much funding. So we have to get creative in Puerto Rico. Yeah.
I see. Well, when you look at Puerto Rico healthcare today versus 5 years ago, what changes stand out the most?
5 years ago, we were in the pandemic, so there were a lot of changes with that only. So now this is normal. We work with teams all the time with Zoom. That's our day-to-day. So in that part, there's been normalization, right? But now we are seeing a lot of changes. We're using more data. We're more digitalized. We're trying to be more interoperable. So that's what we're doing now. That's the difference between 5 years ago and now.
Well, you mentioned, of course, 5 years ago, we were coming out of COVID or still in COVID. Were there any COVID-related activities that maybe changed the way IT thinks about infection prevention in healthcare in the Puerto Rico market or Dorado Health?
Well, that was something we didn't see at all. So
right.
Now we have to be involved in that. So right now it's all about prevention for our patients and for all our staff. So now we're working with you guys with a clean slate. So we're having successful trials in Bayamón in our children's hospital.
Yeah, and of course we're seeing that from our side, and we're really impressed with the strides you guys are taking, and it's the same challenges here in the U.S. in terms of infection prevention. How many facilities does Dorado Health operate?
We have 5 hospitals. We have 3 in the north of the island and 2 more in the west. We have over 55 specialties from cardiology, neurology, and family medicine, and we have an oncology pediatrics area department in children. So we have all the specialties.
Now, Paco, as you've grown and you have multiple facilities, how do you maintain consistency across all these different facilities?
Well, we have a great team here.
All right.
We have combined forces with clinical staff and the IT guys. So we work together all the time. We meet every week, almost 2 times a week, and we overview everything that we do and related to innovation and technology. So nothing is done unless this group say yes, we're going ahead to do it. So.
We know that Dorado Health is looking at more infection prevention solutions through IT. What are you seeing from Trinexus' standpoint in the broader market? Are you seeing more emphasis from the IT side on the infection prevention side? What can you say about that?
Yeah, I guess one of the things that have changed is that IT people and the CIOs have been more involved on what's happening inside the hospital. And therefore, what we see is that compliance is very important, and all the hospitals are just trying to get into comply, get all the numbers there. So yeah, it's getting bigger, the compliance part. So all the hospitals and the people that they are getting around IT, nursing informatics, all the people that support the hospital clinical part are seeing that the IT strategy for comply with the infections and that areas are very important. So they have more focus on that.
So in the U.S., continental U.S., we've seen over the last 10 years the implementation of EMR systems. Are you seeing in Puerto Rico the same kind of implementation with EMR?
Yeah. We are a MEDITECH shop, so we have MEDITECH expense in all our hospitals. And in Puerto Rico, most of the hospitals use MEDITECH EMR. So, yeah.
Okay. And we talked a little bit, Francisco, about the initiatives that you've implemented from an infection prevention standpoint. But when considering new technologies, how do you evaluate which ones align with Dorado Health's long-term strategy for infection prevention, compliance, and patient safety, and balance that against cost, right?
Well, every equipment that we buy, we have to make sure is medical grade. We ask if it helps to prevent cross-contamination. That's something we are looking at always. If it's compliance, how easy is to implement? Is gonna simplify our workflows, or is gonna give us more complexity? That's the things that we look before buying something.
So, Eliezer, when working with systems like Dorado Health, what separates organizations that innovate successfully from those that struggle?
I would say governance is one of the things. The other thing is the team. I guess the health industry and hospitals have changed. So IT is more besides infrastructure that was a standard before. Now I've changed that all the IT people is being more involved on what's happening in the hospital. So the success health systems are the ones that are really involved on what's it needs on the clinical side. So that's a big difference. And I guess, and that's one of the why Dorado Health is been so successful, because they are not only have a very good technical people on the infrastructure part, but they got a great team supporting all the clinical part.
It always comes back to the people, right?
Yeah,
that's correct.
That's you guys. Right?
All right.